Hi, this is Dr. Corey Maas on Looking Your Best. Today I wanted to talk about non-surgical facelift. And this is an interesting topic because in today's world, everything from something that comes in a jar to something that you spray on your face to some LED light that you wave around on your skin has been named a facelift. And that's unfortunate because most of these things provide some benefits in skin tightening and other things, but really don't truly lift the face, neck area, or the brow, which are all distinct and anatomic parts of the face, and certainly are things that we can get improvement on as we sort of eclipse the 40s and get into the 50s and beyond. There are some non-surgical procedures and surgical procedures, obviously, that are minimal in their nature, and I really wanted to get into the specifics of the non-surgical approaches, which really can be done by people who have premature aging, who are in their 40s, and even younger in some cases, that have had extensive sun damage and or changes to the lower face or neck with jowling. The first of those is a treatment that uses ultrasound technology, and through a technique that is now described very widely, known as Ultherapy, using a device that's been widely marketed and is really the only device that the FDA has approved for the term lifting. Ultherapy is a device that provides ultrasound energy to the deeper layers of the fascia, and it's very specific from the skin surface down to 3.5 to 4 millimeters, which is the fascial layer. It doesn't go beyond those layers, and it also doesn't stay above those in the skin itself, where laser skin resurfacing might be helpful. By tightening the fascial layer or the Maas layer, the skin has to be carried with it, and thus lifting in the lower face, neck, or brow area are possible without surgery. Now, I'm very careful to explain to all of our patients that Ultherapy is not a facelift, so someone that has really tautic or sagging tissues is going to have a minimal effect, but they have to understand it's not going to be the equivalent of doing a surgical facelift. The other techniques that are out there, and we'll be showing these briefly, are some of the suture lifts that are available, and these are not like the ones that were very popular a decade or more ago, where there were little barbed threads put underneath the skin. We know those don't work for very long. They were expensive and really a waste of money in the long term. The effects were very short-lived. But a couple of techniques have evolved now over the last 10 years that are beneficial. One of them is called the silhouette lift, which uses small absorbable sutures that are placed along a vector or line that allows lifting of the cheek or jawline through a small puncture incision with an exit point for the suture near or around the hairline, and this special design of little tiny cones that are along the suture line allow the skin and the subcutaneous below the skin tissue to be elevated and displaced for a very long period of time. The company is allowed to promote up to 2 years of elevation. I obviously think it lasts longer than that, but these are intermediate level. They're somewhat surgical in that there's puncturing of the skin, but there's no big incisions made for this, and it allows for elevation of these tissues in a procedure that can be done in the office. I'm going to show you that in a few minutes, along with another technique which I think should be included, which is I refer to as the percutaneous, that means through the skin mid-facelift. This technique, a lot like the silhouette, uses a special type of suture and needles where a tiny little puncture is made at or around this fold between the nose and the corner of the mouth, and it allows us to elevate this fat pad, the cheek fat pad that is just below the skin, that hangs and creates the deep nasolabial fold as we age. So elevating that, putting it back up where it belongs, if you will, is a technique that can be done in the office. I had Channel 4 out not that long ago filming us doing this procedure in the office, and we've now got 15 years of follow-up on a number of patients. So stand by, we'll actually show that intermediate levels of lifting without surgery or with minimal surgical intervention. This is Dr. Corey Maas on Looking Your Best, and we'll be right back with that short video at procedural description.
The Silhouette InstaLift Instructions for Use, or IFU, describes 11 steps for InstaLift implantation. Step number 1. Remove sutures from protective pouch and place in sterile field using aseptic procedures. Step number 2, mark the location where the Silhouette Instalift devices are to be placed. I'm using the provided ruler to place the Silhouette Instalift. The first point I mark is the exit point medially, and then using the 8-cone placement ruler, I mark 4 centimeters, which is the entrance point right here. That's the exit point, inferior exit point. And then we'll also mark the superior exit point right here. So this is a straight vector trying to elevate the midface as per the IFU. We're also going to mark a second line, which is about 1 centimeter lower, more inferior, and the same thing, 4 centimeter past the 4 cones in order to obtain elevation of the midface tissue. Again, a straight vector into the temporal area. And here is the 2 entrance points, medial exit, exit, proximal exit, exit. Again, here is another exit point, just lateral to the nasolabial fold to elevate the midface. And using the ruler provided, we mark out the entrance point at 0, and then again, exit point at 4 centimeters above in the temporal area. So here's a placement of 1, 2, 3 Silhouette Instalift through the midface to elevate the midface. Distal exit points, proximal exit points, entrance points. I have marked out 3 placements of Silhouette Instalift. You can use up to 4 or 5 sutures per side to obtain the desired clinical endpoint. Step number 3, infiltration of local anesthetic at the entry and exit points in the desired area. The entrance points and the exit points are infiltrated with local anesthesia, routinely 1% lidocaine with 1 to 100,000 of epinephrine. The injection is placed in the subcutaneous plane to elevate the tissue and provide vasoconstriction. As you can see, only the area of the entrance points and the exit points was anesthetized. The track of the suture has not been anesthetized. This, we believe, lessens the adhesion and the integration of the tissues. So again, track is not anesthetized, just the entrance and the exit points. Another reason not to anesthetize or infiltrate the track of the suture and the cones is to make sure that you are aware of the track of the needle as you're placing the Silhouette Instalift. Again, do not anesthetize the track. That might obscure the placement and the level of the placement of the Silhouette Instalift. Step number 4, a dissection is made in the proximal exit point using the surgeon's typical approach. A standard incision along the hairline in order to expose the fascia to which the proximal end of the Silhouette Instalift will be sutured. Step number 5. Punctures are made in the midface area. The distal straight needle is inserted through the puncture to the required depth and advanced along the pre-marked location for each suture placement exiting the skin. Entrance points are made using an 18-gauge needle. The entrance points are made vertically through the dermis. Routinely, the entrance points are made in all 3. Silhouette Instalift comes packaged without the knots being tied. I'm about to apply gentle pressure. You can see that the knots are being engaged to the point that they're completely tied and it's ready for use. Step number 6. The distal straight needle exits through the pre-marked location. The needle is pulled through so that the first set of cones is in place in the tissue. The needle is cut from the suture, leaving a small portion of the suture exposed. Step number 7. Repeat for the second needle to insert the other half of the suture. The proximal suture is placed, here's the 23 gauge needle with a 5mm mark on the end. The marking serves the level to which the needle needs to be placed. What's important is the placement should be vertical into the subcutaneous tissue. The needle is turned at 90 degrees and advanced towards the previously marked exit point. The second and third suture is placed using the previously described technique. The important points are in a clinical setting. After the desired and appropriate number of sutures are placed, the tissue adjustment is made in an upright or 45-degree sitting position. There are two techniques that I will describe. First one involves advancement of the tissue towards the center, and the superior tissue is advanced with keeping tension on the suture, proximal suture, and then keeping tension on the distal suture. The tissue is advanced towards the entrance point. You will hear clicking and tissue engagement as you advance the tissue over the cones. To achieve the desired effect, you may only choose to advance the inferior tissue, and this is simply done by just laying down the superior suture, engaging the cones without advancement of the tissue. This area serves as the anchor, and then the inferior tissue is advanced towards the entrance point, feeling the tissue engagement and the quote-unquote clicking of the cones, creating the mound centrally and advancing the inferior tissue. The desired effect may also be achieved by simply laying down the superior cones in a straight line without advancement of the tissue, and then advancing the inferior tissue towards the entry point in a superior direction, advancing the tissue and feeling the engagement of the cones, thereby creating a mound in the midface and advancing the inferior tissue. The inferior tissue, in order to efface the nasolabial fold, is advanced superiorly by holding on to the distal suture and advancing the tissue towards the midface. And you can see the minimization of the nasolabial fold by this maneuver. Step number 10, trim the excess ends of the sutures. It is desirable to bury the end of the sutures either under adjacent mobilized soft tissue or fascia to avoid possible erosion of the device through the skin. Close the incision using the surgeon's typical technique. Gentle tension, retraction of the suture underneath the skin. Gentle tension, again, amputation of the suture, making sure that there is no suture that's palpable. Using a 4-0 nylon, closure of the skin edges is accomplished. Step number 11. Repeat for each silhouette Instalift device implanted. The final two steps in the IFU describe adjustment or removal if necessary. Step number 12. If adjustment or removal of the implant is desired, one may remove the suture and extract the device under direct or endoscopic guidance. Step number 13. If removal of the device is required in the post-operative period, a small incision to release the anchoring to the fascia and remove the device may offer the most straightforward method.